My name's Amy Phillips, and I'm 45. When I was 33, I started having chest pains. And over the course of 3 years, until the time I was 36, I saw 3 different physicians that kind of disregarded my chest pains. And it wasn't until I was at work one day and was having chest pains, I was prompted by a friend to go to the doctor. So I went to the emergency room, and the emergency room doctor suggested that I see a cardiologist. And I did, and I had a stress test, and it was abnormal. And they then performed an angiogram and found that I had 3 arteries clogged in my heart. And as I was laying on the table after they got done with the test, the doctor walks out and he points at me and he says, "You need to quit smoking." And I was absolutely terrified. My options were, well, things that could go to help the heart disease was either bypass surgery or having a stent placed, but because of my age, they decided to put a stent in. And so I had 1 stent placed in my arteries. Since I had the stent placement, I went through the cardiac rehab program with the hospital, and I also an avid bicyclist, and I have done the Seattle to Portland bike ride, 206 miles. I've done the Danskin Triathlon. I've walked the Seattle Half Marathon, done a survival and firefighting course for maritime industry, and I'm a huge advocate of healthy eating and living, and I've quit smoking. I've lost 85 pounds, and I am constantly aware of that I do have heart disease, and it's something that I need to think about on a daily basis.